Good morning, and welcome to Defeat MSA Alliance's inaugural Global MSA Support Symposium, MSA A Path Forward. I am Dr. Pratik Bhattacharya. I am a neurologist by profession. I work at St. Joseph Mercy, Oakland, a hospital in the Metro Detroit area in Michigan. With Philip Fortier, I am the co-founder of Defeat MSA Alliance. The inspiration for the founding of Defeat MSA Alliance was Philip's eldest brother, Joe Fortier, who succumbed to MSA in 2013. Joe was born on August 4, 1956. He attended Catholic schools in Detroit and graduated from the University of Detroit Jesuit High School in 1975. In his early life, Joe was a strong swimmer, a lifeguard, and scuba diver. After high school, Joe began a career in sleep disorders. He attended college at University of Detroit and Wayne State University. He held positions at Henry Ford Hospital in sleep disorders and at the VA Medical Center, both in Detroit. For more than 25 years, Joe managed sleep clinics, consulted on sleep research, conducted sleep studies, and helped establish multiple sleep clinics throughout Michigan. Philip would talk to me about Joe's early symptoms in 2008. He started out with an ear-nose-throat evaluation for swallowing problems. When workup did not reveal an answer, he was seen by a neurologist. He was prescribed a few medications for Parkinson's disease. When his symptoms did not improve, he was sent to a university hospital for a second opinion with a movement disorder neurologist who confirmed a diagnosis of multiple system atrophy. Many in the audience today may be able to relate to Joe's story. Joe was a strong and loving family man who had a quick wit and a great sense of humor. He was an avid reader of novels, current events, history, health fields, marine biology, and international affairs. Active in local politics, raised by parents who were both involved in the civil rights movement, and educated by the Jesuits, Joe was greatly influenced by the notion that he was to be a man for others. He was committed to the philosophy that the use of one's skills in helping others was the best thing anyone could do, and this he did in his own life. On his 55th birthday, Philip presented him with a birthday gift: the filing papers for a non-profit organization that is known today as Defeat MSA Alliance. Joe's wish for Defeat MSA Alliance was to help others who suffer with the same affliction he endured and to advance medical research to help others. We at Defeat MSA Alliance hope to do our part to continue the mission inspired by Joe Fortier. As any new MSA patient realizes, the disorder is oftentimes misdiagnosed, and public attention to the disease is almost non-existent compared to the more widely known conditions such as Parkinson's disease, multiple sclerosis, or ALS. MSA patients are confronted with a dim prognosis and left with few options. Defeat MSA Alliance aspires to balance efforts to support patients, educate medical professionals, raise public awareness, and nurture promising research. Staffed entirely by volunteers, all of whom have some personal connection to MSA, Defeat MSA aims to achieve 4 goals. To build a community that truly serves those who suffer from MSA, to cultivate promising research into treatments in slowing MSA, to nurture better education of health professionals about MSA, and to raise greater public awareness about living with MSA. Our first pillar is patient and caregiver support. Some examples of our efforts towards this mission are the MSA Loaner Closet, where patients with limited insurance and resources can borrow equipment for use. In-person support groups and extensive online groups, including video chat support groups for patients and present and past caregivers. Development of a global platform for video chat support groups called the Brain Hub as a downloadable app. COVID care kits. We sent out COVID care kits to patients dealing with the consequences of this pandemic. Social media support efforts through Facebook, Instagram, and Twitter. And finally, this virtual conference. The second pillar is medical research into MSA. Examples of our efforts include advocacy with industry to support new treatments for patients, efforts to support new drug trials, including some for drugs that are close to clinical use. Our involvement is in spreading information about the trial among the patient community and facilitating those interested in clinical research by linking them with research centers. Defeat MSA Alliance funded a drug repurposing study at the University College of London. A drug which is currently used for a different indication and has shown promise in affecting the alpha-synuclein pathology of MSA. Brain donations. We have educated patients on the value of brain donations and continue to facilitate several donations on an ongoing basis. We also initiated the first steps to support a genome-wide association study in the US and Canada for multiple system atrophy. Our third pillar is medical education and advocacy. Our efforts in this arena include representation at the American Academy of Neurology, which is America's largest professional organization supporting the needs of neurologists across America. For the first time in their history, we organized a panel of patients describing their perspectives on the disease, sharing the story of their road to diagnosis to a room full of neurologists. As a nonprofit, we advocate and educate regularly at conferences for medical professionals. Clinical educational materials. We have produced various documents and brochures to educate medical professionals about the lived experiences of the patients. We helped successfully advocate at the FDA hearing for approval of a medication for the management of neurogenic orthostatic hypotension called droxidopa. Our fourth pillar is public awareness. Of the numerous activities we have done to promote public awareness, I will highlight two today. The Defeat MSA Awareness Shoe, a globe-trotting shoe that we have used as a tool to raise awareness across the continents. Currently, there are MSA awareness shoes in Greece, UK, Australia, and in Spain outside of the US. Defeat MSA Alliance successfully kickstarted a worldwide fundraiser to support the completion of A Day for Susanna, the first feature-length documentary about a world champion athlete and her preparation for the Paralympics as she dealt with disabilities from MSA. This award-winning film will be live-streamed at 7 p.m. this evening, and I would urge everyone to attend. Defeat MSA Alliance has also played a part in the founding of 3 other MSA charities: Defeat MSA Canada, Defeat MSA Australia and New Zealand, and Defeat MSA Awareness Shoe, a global awareness campaign. Together with Combatiamo MSA Italia and Association Scheidreger in Spain, these 6 charities have formed a support and research consortium called MSA United International. Today's agenda includes several exciting clinical and research keynote speakers. We will start our day with Dr. Anthony Lang from the University of Toronto, who will take us through the clinical features, diagnosis, and pathology of MSA. Our second keynote speaker is Dr. Edwin George from Wayne State University, who will discuss current treatment options for MSA. Our third speaker is from New York University's Horatio Kaufman, who will lay out clinical trials in MSA. Our research keynote speaker is Dr. Patrick Brunden from the Van Andel Institute in Grand Rapids, Michigan, who will enlighten us on possible disease mechanisms and research. We will have 2 discussion panels. The first session will have 2 talented speech and language pathologists with a personal connection with MSA. They will cover issues with speech and swallowing. Sisters Jennifer and Rebecca lost their father to MSA. The second panel will feature presentations from a physical therapist, Michelle Weaver, and occupational therapist, Kerry Ryhoff, about the benefits of therapy in this disease. We would like to extend our sincere appreciation for our moderators for today's session. Dr. Teo, a movement disorder neurologist based in Moscow, Russia, will moderate the clinical Q&A session. Dr. Pielertz, a scientist specializes in synucleinopathies including MSA, from Leuven, Belgium, will moderate the research Q&A session. Elena Fracassa, board member of Defeat MSA Alliance, an occupational and environmental health expert, will moderate the speech and swallowing session. Finally, Dr. Kevin Kwok, doctorate in pharmacy, will moderate the PT and OT question-answer session. This pandemic has made us think out of the box and creatively to organize this conference. A big positive is that we are able to enjoy learning from the comfort of our homes, getting access to speakers in different parts of the world through the World Wide Web. On your web page, you will be toggling back and forth between the main broadcast window, which you are currently viewing, and the blue buttons below the broadcast window, which takes you to the individual Q&A sessions in the agenda. These blue buttons will take you to a Zoom session, allowing you, the participants, to interact with the moderators and speakers. Between 11:45 a.m. and 12:30 p.m., we will break for lunch. The afternoon sessions will run until 4:45 p.m. After that, I would encourage you to return to the viewing of A Day for Susanna, a live streaming of the film that I alluded to earlier. The big red button on your page will take you to the streaming site for the film. You will find the big red button below the broadcast window. So, without further ado, let's begin our first clinical talk for the day.